Welcome. My name is Autumn Hume. I am the account director with the Muscular Dystrophy Association's Healthcare Partnerships team. Thank you for joining us for this MDA Industry Update webinar presented by UCB about Generalized Myasthenia Gravis. MDA's Industry Update webinars are programs which provide an opportunity for the community to receive information and updates impacting care and treatment directly from pharmaceutical, biotechnology, and medical equipment companies. These webinars are just a part of MDA's education resources. We encourage you to visit the MDA community education pages on mda.org, where you will find an abundance of resources, informative recorded webinars, and listings for upcoming educational events. Of course, if you have any questions or need assistance, the MDA Resource Center is available to you by email at resourcecenter@mdausa.org by calling 1-833-ASK-MDA1, or you can reach the Resource Center on mda.org. So now I would like to introduce our distinguished presenter, Dr. Christyn Edmundson. Dr. Edmundson is a neuromuscular specialist living in Seattle, Washington. A graduate of Brown University and Albert Einstein College of Medicine, she completed her internship and neurology residency at the Hospital of the University of Pennsylvania from 2012 to 2016, where she was recognized with multiple teaching and clinical awards. She completed her neuromuscular medicine fellowship at Harvard Partners, Brigham and Women's Hospital, Massachusetts General Hospital in 2016 through 17, before returning to the hospital of the University of Pennsylvania as an assistant professor of neurology from 2017 through 2021. In 2021, Dr. Edmundson moved with her family to Seattle, where she practices at the Swedish Neuroscience Institute as the director of neuromuscular medicine. Dr. Edmundson has particular clinical interest and expertise in autoimmune and hereditary neuromuscular disorders. She is also dedicated to medical education. In her time at the University of Pennsylvania, Dr. Edmundson served as the director of the Neuromuscular Medicine Fellowship, assistant neurology clerkship director, and was involved in resident education. Her teaching efforts were recognized by induction as a faculty member of AOA in 2020. Since her move to Seattle, Dr. Edmundson has taken on the role of site director for the neurology clerkship at Swedish Neuroscience Institute. Dr. Edmundson has authored or co-authored multiple published articles and chapters. She frequently speaks at regional and national conferences, including AAN and AANEM annual meetings. So without further ado, I will hand it over to you, Dr. Edmundson.
Well, thank you so much for that introduction, Autumn. And thank you everyone for being here today. I'm really looking forward to reviewing some of this information with you guys and then taking whatever questions you have at the end of the presentation. And I will say I will do my best to keep this in sort of layperson's terms. Some of it can get a bit technical, but if there are any points that need clarification, I'm more than happy to offer that sort of at the end of the talk. So what we're going to be discussing today is some updates in treatments for generalized myasthenia gravis, specifically Rystiggo, also known as rozanolixizumab, although Rystiggo is obviously easier to say than rozanolixizumab. And I will be discussing sort of myasthenia background, some information about Rystiggo and trial data, and information about sort of prescription and monitoring today. So Rystiggo is the first FDA-approved treatment for both acetylcholine receptor and MuSK antibody-positive myasthenia gravis, generalized myasthenia gravis in adults. And we'll talk a little bit more about what I mean by these antibodies, what I mean by generalized myasthenia gravis, but just at a high level. Some key points which you will hear from me several times today are that Rystiggo is given as a subcutaneous infusion, so it's given under the skin rather than in a vein, and it takes about 15 minutes to give once it's been prepared, followed by a 15-minute observation period. It is administered by a healthcare professional, and Again, this is approved specifically for these antibody-positive generalized forms of myasthenia. Important safety information, which is, I think, continued onto the next page. And again, we'll go into a lot more detail, but the most common side effects of Rystiggo include headache, infections, diarrhea, fever, and hypersensitivity reactions. Other things that we'll discuss in more detail, Rystiggo may increase the risk of infection and it can cause aseptic meningitis. Because of this, you'd need to tell your healthcare provider right away if you have signs or symptoms of infection or meningitis during treatment with Rystiggo. Rystiggo has also caused reactions including swelling and rash. If you ever have any undesirable reactions, you should tell your healthcare provider immediately, particularly about things like headache, infections, diarrhea, fever, hypersensitivity reactions, and nausea. And again, we'll dig into each of these pieces in a little bit more detail. So a quick overview from sort of a 1,000-foot view. We'll talk about generalized myasthenia gravis. We'll talk about how Rystiggo works. We'll review results from the trial of Rystiggo that led to its FDA approval. We'll talk about what to expect with Rystiggo treatment. And then we'll talk about the Onward program that UCB offers to help support patients who are starting Rystiggo. We'll talk a little bit about ways that you can talk to your doctor about Rystiggo, what questions might be helpful, and then we'll have some time for questions after the presentation is concluded. So about generalized myasthenia gravis, and my guess is that many of you in the audience are familiar with these terms and with generalized myasthenia, but let me just provide sort of a definition for some of the terms that are going to come up frequently in this presentation. So one term that we will use a lot is the immune system. And again, many of you probably know this, but the immune system is essentially a system, a complex system in the body that helps protect your body from infection and disease that uses specialized cells and organs. Autoimmune is a term that refers to conditions where the immune system accidentally or sort of in a misfired or misdirected way attacks the body's healthy structures and tissues. So rather than going after things like infections or cancer, the immune system instead attacks healthy, normal parts of the body. And then the term chronic, which we use to refer to a lot of diseases, just means something that's either long-lasting, persistent, or constant, something that occurs over a long period of time. So to sort of use these terms, put it together with myasthenia, what is myasthenia gravis? So myasthenia gravis is a chronic autoimmune disease, and it's caused by problems in the signaling between nerves and muscles, this part of the body called the neuromuscular junction, where the nerves and muscles connect and signal. And basically the immune system misfires and attacks that connection between the nerve and muscle. So generalized myasthenia gravis, or GMG, is a more severe form of myasthenia that can weaken muscles throughout the body. So myasthenia is divided and broken down in a lot of different ways, but one of the ways it can be broken down is between ocular myasthenia and generalized myasthenia. So ocular myasthenia, or ocular MG, only affects muscles in and around the eyes. So common symptoms are things like ptosis or drooping eyelids, double vision. In generalized myasthenia gravis, or GMG, the eye muscles can also be affected, but people have symptoms outside of just the ocular areas, and that can look like weakness in arms and legs. It can look like difficulty chewing, swallowing, breathing, speaking, or swallowing. And together, all of these symptoms of myasthenia gravis, or GMG, can cause issues with activities of daily living, things like climbing the stairs, chewing, brushing teeth, washing hair, etc. So a bit more about GMG. In 95% of patients with GMG, one of these two antibodies can be identified, either the acetylcholine receptor, or AChR antibodies, or anti-MuSK antibodies. A small percentage of patients with GMG don't have an identifiable antibody, but the vast majority of patients do. And this treatment that we're talking about today, Rystiggo, is approved specifically for patients who have either AChR or MuSK antibodies and have GMG, generalized symptoms. So a little bit more about the underlying pathophysiology to get in the weeds on how myasthenia gravis is caused. So again, some important terms to introduce: the neuromuscular junction, or NMJ. This is the connection where the nerve and muscle meet. When the signal between a nerve and muscle is interrupted, muscles can grow weaker because that neuromuscular junction is damaged. Neurotransmitters, that's a term that refers to chemical signals that carry information from nerves to muscles, sort of across a space. Or, it's not always nerve to muscles. Neurotransmitters can carry information from nerve to nerve. In the neuromuscular junction, neurotransmitters carry signals from nerves to muscles. And then a receptor refers to proteins in or on cells that receive chemical signals. So in the neuromuscular junction, which we see over here on the left, this is the end of a nerve which is connecting to a muscle at the neuromuscular junction. And what happens, excuse me, is that electrical signals come from the brain, travel down the spinal cord and through nerves, and then end up at this nerve terminal at the end of the nerve. That electrical signal causes the nerve to release a neurotransmitter called acetylcholine into the neuromuscular junction. Those chemical signals travel across this space and then bind to receptors on the muscle, specifically here acetylcholine receptors. When the neurotransmitter binds to its receptor, that signals the muscle to contract and generate force. So this is a really important part of how signals travel from sort of the brain, spinal cord, nervous system, and then actually generate strength in the body. Another important GMG term here is antibody, which again, many of you have probably heard of, and I've even used that term already in this talk. So an antibody is part of the immune system. And when acting normally, antibodies protect you against things like bacteria and viruses, fungi, and even cancer. When acting abnormally, antibodies, if they sort of target normal parts of the body, cause autoimmune disease. And in generalized myasthenia, or GMG, disease is caused by antibodies that get in the way of the signaling between the nerves and muscles. So you can see here a neuromuscular junction in someone who has myasthenia gravis. These sort of spiky red things represent antibodies, either acetylcholine receptor or anti-MuSK antibodies that attack proteins at the neuromuscular junction and get in the way of the chemical signals that are coming from the nerves. That results in sort of weaker signaling from the nerves, which means the muscles aren't getting signals to contract, and that leads to muscle weakness. Classically in myasthenia, fatigable weakness, where the more you use the muscles, the weaker they get, which is kind of the hallmark of MG symptoms. So we'll move on now to talk a little bit more about how Restigo works. And in order to talk about how Restigo works, I'm going to introduce you to this system called the FcRn system. And in contrast to like the immune system and the nervous system, which many of us have heard of, most of us probably haven't heard of the FcRn system. I hadn't, even in medical school. It's something that I learned about sort of later once I was in practice, as many of these drugs that affect this part of the immune system have been developed. So essentially, the FcRn receptors, FcRn system, is an antibody recycling mechanism. It's a way that the body sort of protects antibodies and makes them last longer in your body. Antibodies are made by immune cells and they degrade over time. So most antibodies last for maybe 3 months in the body before they're sort of naturally broken down. Part of why they last that long is because of this protective system, the FcRn system. So what happens is antibodies are kind of always being sampled by a lot of different cells in the body, including these cells that line blood vessels. So they're called endothelial cells. Endothelial cells line blood vessels and are always kind of sampling the blood and the plasma that's traveling through the blood vessel. So here some plasma, including antibodies, are being sampled and kind of like taken into a cell for examination. Antibodies that are bound to this FcRn receptor, represented by this yellow thing here, antibodies that bind to the FcRn receptor are protected. They kind of cycle through the cell and get released back into circulation to kind of go out and continue doing what they do, whether that's sort of protecting you against bacteria or attacking the neuromuscular junction in the case of myasthenia antibodies. In contrast, antibodies that are not bound to the FcRn receptor, they get broken down by the cell. They get kind of like chewed up and destroyed. So this FcRn receptor binds to antibodies, protects it, and makes it last longer in the body. Restigo works by blocking FcRn receptors. So in this picture here, this green structure is Restigo. And it's a molecule, it's a drug that's engineered to really, really, really tightly bind to FcRn receptors. It binds to these FcRn receptors even better than antibodies do. So in the presence of Restigo, these FcRn receptors kind of all get bound by Restigo, which means that the antibodies in the blood don't have spots on the FcRn receptors. So more of them are kind of left floating in the cell, and then they get broken down. So essentially, FcRn inhibitors like Restigo, they block the FcRn system, and they kind of trick your body into breaking down antibodies, including the potentially harmful antibodies that cause myasthenia gravis, the acetylcholine receptor or AChR and MuSK antibodies. In terms of results with Restigo, so looking at the clinical trial that led to Restigo's approval by the FDA. This was a large study for MG, GMG, GMG being a rare disorder. There were 200 participants, which is a pretty large study. They looked only at adult patients with GMG, generalized myasthenia, who had acetylcholine receptor or MuSK antibodies. Those 200 patients were divided into 3 different groups. A third of patients were left on placebo, so they were left on whatever medicine they were already taking, and then they were given infusions, but it was an infusion that did not contain Restigo or another drug. And then a third of patients were given a low dose of Restigo infusion, and a third were given high dose. And again, all of these people were continued on whatever therapy they were already taking, and Restigo was added on, or placebo was added on. And in this study, people received 1 dose weekly for 6 weeks of either Restigo or placebo in addition to their current treatment. And after those 6 weeks of treatment, so once a week, they're getting infusions for 6 weeks. That was followed by an observation period of up to 8 weeks. In terms of the results, what the clinical trial found is that Restigo significantly improved activities of daily living, things like breathing, talking, swallowing, being able to get out of a chair. The way they measured this is with a tool called the MG-ADL, which we'll talk a little bit more about, but it's basically a score of symptoms that many of you probably have done by your doctors at clinic visits. And a significant improvement is considered a reduction in that score of 2 points or more. So at the end of the 8-week observation period, patients who had gotten Restigo were doing better compared to the patients who got placebo in terms of their MG-ADL score. And that improvement was actually fairly rapid. You could see improvement by the end of 6 weeks, those 6 weekly infusions. And in some patients, they saw benefit as early as 1 week after the first dose of Restigo. So a little bit more, I kind of explained the MG-ADL score, but to dig a little bit more into exactly what that is, it's an 8-category questionnaire that looks at GMG symptoms in different domains, such as double vision, eyelid droop, arm and leg weakness, symptoms that affect chewing, swallowing, breathing, and speaking. The worst score you can have is 24, so that's like the maximal symptoms, and the best score is 0. So we always aim for folks to have a score of either 0 or sort of as low as possible. So lower scores mean fewer symptoms. Some other results that they found were that up to 72% of people who received Restigo had a significant improvement in symptoms. And again, that's measured by the MG-ADL score, and specifically a reduction in the MG-ADL score of 2 points or better. So a response doesn't necessarily mean all of the symptoms are gone. It means that there was a meaningful improvement. Now, that does still leave 28% of people who received Resigo who didn't have a clinically meaningful response. So just like many other drugs in the myasthenia space, it works for some people, and for some people it may not work as well. I will also say that this number, the 72%, was what we call a post hoc analysis. So it's something that was looked at after the information was gathered. The study wasn't specifically designed for this specific piece of data, so you need to take it with a little grain of salt. Another piece of information that was found through kind of looking at the data after the fact was that all of the MuSK patients who were treated with Resigo had a clinically meaningful response, so had that reduction of 2 points or better in their MG-ADL score. Now, again, this needs to be taken with a grain of salt because the numbers were really small. There were only 12 people with anti-MuSK GMG who were treated with Resigo in the study. So a small subset, but nonetheless sort of encouraging to see that all of the patients in that group did have a response. So moving on to talk a little bit about safety and side effects. So this table shows the side effects that people taking Resigo experienced. And it shows side effects that were experienced by at least 5% of people getting Resigo, and that were more common in the people who got Resigo compared with placebo. So you can see most common side effects, which I kind of listed out quickly at the beginning of the presentation, included headache. So 44% of people who got Resigo had headaches compared with 20% of people who got placebo. So certainly, getting placebo folks got headaches as well, but it was more than twice as much in the Resigo group. There were also higher rates of infection, including upper respiratory tract infection in people who got Resigo. I am coughing right now because I'm at the tail end of an upper respiratory tract infection. So things like colds, etc. Diarrhea was also more common in the folks who received Resigo compared with placebo. And then fever, hypersensitivity reactions, nausea, administration site reactions, which are like, rashes or swelling or itching at the site of the injection or infusion. Abdominal pain and joint stiffness were all also more common in patients who received Resigo compared with placebo. So this is a really busy slide. I will kind of walk you through what this says and give you some time to read it as well. This is important safety information that comes from the label in Resigo, and that is that, as we talked about on the last slide, Resigo increases the risk of infection. In clinical studies, the most common infections that people with Resigo had were upper respiratory tract infections, COVID, which also kind of is an upper respiratory tract infection. My cough is from COVID a week or two ago. Urinary tract infections, and herpes simplex, which is typically oral herpes. So your healthcare provider should check you for infections before starting on Resigo. And if you have a history of infections, particularly recurrent or chronic infections, you would absolutely want to tell your healthcare provider that. And then if you develop signs or symptoms of infection during treatment with Resigo, you would also want to tell your healthcare provider right away. That includes symptoms like fever, chills, painful urination, cough, runny nose, wheezing, shortness of breath, fatigue, sore throat, lots of phlegm or nasal discharge, back pain, or chest pain. When you think of meningitis, you think of like a bacterial infection, or that's what I usually think of. In Resigo, for some of the people who received Resigo, they got something called aseptic meningitis, which is inflammation or irritation of the meninges, which is kind of the lining of the brain. And that causes severe headache, neck stiffness, drowsiness, fever, feeling really sensitive to light, pain with eye movements, and even nausea and vomiting. And then hypersensitivity reactions, which are basically like allergic reactions to the medication. So Resigo can sometimes cause swelling or rash. During Resigo infusion and for 15 minutes after, you should be monitored for hypersensitivity reactions. And if you develop any undesirable reactions, you'd want to tell your healthcare provider immediately. And then in addition, before taking Resigo, it's really important to have a thorough conversation with your doctor about all of your medical conditions, including if you have a history of infection, or you think you have an active infection, or if you've recently received or are scheduled to receive a vaccine or immunization. There are no specific vaccines that people with Restigo need to get that are different than the general population, but certain types of vaccines, specifically live or live attenuated vaccines, their safety has not been studied in patients who are in people who are on Restigo. So ideally, you would want to get whatever age appropriate vaccines that you're due for before starting treatment with Restigo. Some other important safety information. Restigo and the safety of Restigo has not been studied in people who are pregnant or breastfeeding. So you should tell your healthcare provider if you are pregnant, plan to become pregnant, are breastfeeding, or plan to breastfeed. And then it's always a good idea to review with your healthcare provider all the medications that you're taking, including prescription medications, over-the-counter medications, and vitamins or supplements. And then again, not to belabor this point, but the most common side effects of Restigo are headache, infection, diarrhea, fever, hypersensitivity reactions, and nausea. These are not all of the potential side effects of Restigo, and for more information, you can ask your healthcare provider or pharmacist. And then if you develop any side effect that bothers you or isn't going away, you want to tell your healthcare provider right away. You can also report negative side effects directly to the FDA by using their website or the phone number that's listed here. And then you can see that the full prescribing information. So that can obviously be a little bit technical, the sort of big folders with a lot of small text. So moving on to what to expect with Restigo. So as I'd mentioned at the beginning of this talk, Restigo, which is approved again for adults with generalized myasthenia who have acetylcholine receptor or MuSK antibodies. So Restigo is administered as a subcutaneous infusion. So rather than a needle being put in the vein and medication being given through a vein, which is an IV medication, in this case, a small needle is inserted under the surface of the skin, sort of below the in the stomach, below the belly button, and the medication is infused underneath the skin. That infusion takes about 15 minutes. And most people will end up getting this at an infusion center or their doctor's office, or possibly in some cases at their home through a home infusion service. And then you'd be monitored during that roughly 15-minute infusion, and for 15 minutes after your infusion is complete. The reason I say roughly 15 minutes is that the dose of Restigo is somewhat based on weight. So folks who are less than 50 kilograms, 50 to 100 kilograms, and over 100 kilograms receive slightly different doses of Restigo. So if you're on the lowest dose, the infusion will be a bit shorter. If you're on the highest dose, the infusion would be a bit longer. And then what to expect in terms of, overall treatment. So we've talked a little bit about what the infusion itself consists of, a subcutaneous infusion that takes roughly 15 minutes. Restigo is administered in courses, kind of cycles of 6 weekly infusions. So you get an infusion once a week for 6 weeks, and then kind of have this treatment break where you see how you do. And then if you need to be treated again, you get another course of 6 weekly infusions. And most people who receive Restigo will need multiple cycles of Restigo to manage their myasthenia, their GMG. So after this first treatment cycle, during that treatment break, it's really important to track your symptoms, discuss your symptoms with your doctor so that together you can plan your next steps in terms of when you would get your next cycle of Restigo. It is important to know that, there's sort of a minimum treatment break that we know to be safe. So in a long-term extension study that followed that initial clinical trial of Restigo, the minimum length between the first dose of one treatment cycle and the first dose of the next treatment cycle was 9 weeks. So essentially that looks like 6 weeks of treatment followed by about 4 weeks off of treatment, and then starting a next treatment cycle. So some people may be able to go a lot longer than that, but the soonest that your provider would likely treat you again is with about a 4-week break between the end of one treatment cycle and the start of the next. So in terms of what that looks like, that monitoring during the break between cycles. So everyone who receives this may respond differently, and it's important to understand how you respond and how your symptoms respond to Rystiggo, and then how they return, or if they return during a treatment break. So you want to track any myasthenia symptoms that return during breaks. You also want to track how your symptoms do with the Rystiggo infusion. When did you start to see an improvement? What symptoms improved? How much did they improve? And then during the treatment break, what symptoms are coming back? How quickly are they coming back, to help plan when a next treatment cycle would be warranted, after discussing that with your primary or with your healthcare provider, likely your neurologist. So again, some of this is repetitive, but before receiving Rystiggo, be sure to talk to your healthcare provider about all your medical conditions, including infections, vaccine and vaccine needs, and any pregnancy plans or breastfeeding, in addition to talking about all of your medications, including supplements and vitamins. And then it's important to always take Rystiggo as prescribed. Even if you're starting to feel better, you don't want to skip infusions or discontinue infusions without talking to your doctor first. So this Onward program that is run by UCB, which is the company that makes Rystiggo, is designed to sort of help people in a personalized way as they're starting and receiving Rystiggo. So once your doctor has prescribed Rystiggo to you, you can start getting support in various steps of this process. So to get information from Onward, you could visit the website or call this number. And what Onward provides includes a medically trained care coordinator who can kind of help assist you through the process of starting and continuing Rystiggo. It can provide help with reviewing your insurance coverage and looking at options for financial assistance, even if you don't have insurance. It can help you look at tools and resources to help you get started on and then sort of plan to continue Rystiggo. And it can give you guidance in terms of how to track your symptoms for ongoing support and treatment. And then in terms of talking to your doctor about Rystiggo or really any drug, right? Some good questions that can help prompt a useful discussion between you and your individual doctors include, what symptoms should I be looking for? How will I know if there are new symptoms related to myasthenia? What can I expect when I receive a Rystiggo subcutaneous infusion? What do I need to consider before starting Rystiggo, particularly a cyclic therapy like Rystiggo? And if I'm prescribed Rystiggo, what should I expect on infusion days? How can I prepare? And then during the Rystiggo treatment and break, and again, I think some of this is repetitive, but always good to keep in mind that during a treatment cycle, keep track of side effects, right? Keep track of the symptoms that may be improving during that cycle. Between treatment cycles, make note of what myasthenia symptoms return and when they return, how bad they are when they come back. And then see if there are things even beyond kind of like the individual symptoms you're having. It can be really helpful to consider sort of your overall function. Are there certain goals that you're achieving before you start treatment that you are or aren't reaching? And all of that put together can help you plan with your doctor what sort of a longer term therapeutic plan looks like with a drug like Rystiggo. So to summarize, Rystiggo has been shown in a clinical trial to reduce MG symptoms, and people who were treated with Rystiggo saw significant improvements in their MG-ADL in many cases compared with placebo. It's a targeted GMG treatment that works by targeting the FcRn system and sort of reducing the half-life, reducing how long harmful antibodies that cause GMG are around in your body. So once the drug is prepared, infusions times take about 15 minutes, depending on the dose that you get, followed by a 15-minute observation period. That's the information that I'm presenting today. Thank you so much for your time and your attention.
Thank you so much to UCB for sponsoring this webinar today. Thank you, Dr. Edmundson, for presenting, and thank you to everybody who attended and your engagement. We really appreciate it.